All right, so we can go ahead and get started to be respectful of your time since you were here. Thank you so much. Let me go ahead and just get this ready to present. Do you need translation at all? Spanish translation?
English is fine.
Okay, perfect. So, they're the translators. So if we don't need translation, then you're welcome to just listen to the presentation. And then if somebody comes in who needs it, then you can help them out.
Thank you.
Yeah. All right. Well, good morning. My name is Sarah Vaughn. Thank you for coming. I'm the program supervisor for all of our adolescent community engagement programs at St. Ysidro Health. So why this isn't connected. Okay, so if you've heard of San Ysidro Health, we're one of the largest federally qualified health centers, community health centers in San Diego County. We have 34 clinics and sites across the county, all the way from San Ysidro to Campo in East County to Vista in North County. And we have about 107,000 patients that we see every single year. So the way that the teen programs, the adolescent programs kind of fit into the bigger San Ysidro Health umbrella, since we have all types of healthcare, we are under our research and health promotion department, and then our adolescent programs, and then we actually do have a teen clinic, which is specific for people aged 12 to 24. And we focus mostly on sexual and reproductive health care for young people. So I'll talk a little bit more about that. We're really close to this school, actually, to this school. We're on 3rd Avenue, so it's about a mile away. And we are in-person appointments and telehealth appointments. And at Teen Clinic, we provide sexual and reproductive health care, everything including like birth control, condoms, pregnancy testing, STI testing, health education, all of those things to keep teens healthy if and when they're choosing to have sex. And the reason why Teen Clinic is so important is because in the state of California, we have something called minor consent laws. So what that means is that anyone 18 and under can consent to the treatment and any type of testing, getting on birth control, any of that stuff. They're legally allowed to do that in the state of California without a parent's consent. So does that mean that we want them to have those conversations about their health without their parent? Absolutely not, because those are serious conversations. We want them to have a trusted adult in their life. But because they're legally allowed to do that, there needs to be places where they can access those services. And so that's why Teen Clinic exists. And Teen Clinic has health educators. So if a patient were to come in, they would meet with a health educator and really talk about like what, is going on in their life, what they're looking for in terms of healthcare, and how we can help them. So in the state of California, anyone of any age, whether they're under 18 or over 18, can consent to pregnancy-related care and prevention, family planning services, and sexual assault services. Over the age of 12, they're also able to consent to sexually transmitted disease treatment and prevention, which includes vaccination for HPV, which is human papillomavirus, and PrEP, which is a medication to help prevent HIV. They're also legally allowed to consent to some drug and alcohol abuse treatment or counseling, and also mental health outpatient care. So at Teen Clinic, we don't provide like any type of substance use or mental health treatment or counseling. but we do make referrals to other San Ysidro Health programs that would provide that. Okay, so I wanted to share with you a couple of other programs that we have in our adolescent services that aren't related to teen clinic. So we have our youth mental health first aid training. This is a wonderful training. It is an 8-hour training, so it's a full day, or it's broken up into 2 4-hour chunks. And what this does is it essentially makes you a first responder for mental health crises. So let's say your child or somebody that you are close to, a family member, maybe you work with young people, they're experiencing a mental health crisis. So just like you would have a first aid kit for, like, they get cut, or you'd call a first responder, this training makes you a first responder for a mental health crisis. If you're interested in this training, you can contact my colleague Valeria, and you can schedule a training with her. All right. So the next resource we have is our teen clinic outreach and social media. So we do have a really active social media account that's geared towards, obviously, young people, our patients. All of the content on social media is made by our health educators and our high school interns. And then we do a lot of outreach as well in the community. So at schools, at health fairs, that type of thing. All right, so I wanted to also share this opportunity. So this is the Peer Health Advocates, a high school internship program, and we're currently accepting applications. So if your child is someone who's like really involved in like social justice, really likes civil rights, community engagement, they're interested in health, this would be a good opportunity for them. So they're able to work with the staff health educators and learn about teen health issues, build community service hours, build facilitate community events, and make social media. So we are accepting applications right now at syhteenclinic.org. All right, so I wanted to just talk briefly about birth control methods. This is a presentation that we actually give to youth in schools. Sexual health education is mandatory for middle and public high schools. So it must be taught at least once in middle, and it must be taught at least once in high school. You have the option to opt your child out of instruction if you wish, but it is part of the California Education Code. So this is an example of a presentation that we would do. So we would talk about birth control methods and kind of dive into like hormonal methods, barrier methods, and how they prevent pregnancy. So without birth control, 85 out of 100 people who have vaginal sex without birth control have an 85% chance of becoming pregnant within 1 year. So that's a pretty high statistic. Obviously, if you're a young person, the chances are much higher because you don't kind of have that biological clock situation. And so that's why if a young person is having sex, it's really important to have the conversation about birth control with them to prevent any type of unwanted pregnancy. So there's 3 types of birth control that we talk about with students. The first one is abstinence. The second one is hormonal methods. And the third one is a barrier method. So there's really no like best method for everybody. It really depends on what you and your partner are comfortable with. And it really depends the effectiveness on how you use it, if you use it correctly and consistently. So question for you all, my lovely audience, what method of birth control is 100% effective? Yes.
Abstinence.
Yes, correct. Abstinence. So abstinence is the only 100% effective method of birth control. And this will prevent STIs, HIV, and pregnancy if used correctly. So abstinence, the definition that we give to young people, and it's very important that you like define it, right? Because abstinence means something different to everybody. But in this case, in order for it to be 100% effective, it would mean not having any oral, vaginal, or anal sex or any genital to genital touching, okay? Because some STIs can be spread just through genital to genital touching. If someone is choosing to be abstinent and they're in a relationship, they need to be really communicative with their partner. Like if this is the way that they're going to prevent STIs, HIV, and pregnancy, they need to be having those conversations. Both partners need to be on the same page. And people can really choose to be abstinent at any point in their life, whether they've had sex in the past, whether they haven't. You can choose to be abstinent at any point in your life. All right. So moving on to how hormonal birth control works. So hormonal birth control are going to be things like the pill, the patch, the ring. Those are types of hormonal birth control. The way they work is 3 different ways. So you can see here, this is the internal reproductive system. This is a uterus with fallopian tubes, ovaries, and then the vaginal canal. So it works in 3 different ways. The first way is by thickening the cervical mucus. So the cervix naturally has mucus. That's just part of the anatomy. It's actually very important and it helps with ovulation. It helps with someone to get pregnant. But in this case, when we're trying to prevent pregnancy, the birth control, hormonal birth control will actually make it really, really thick, meaning that sperm will have a really hard time passing through into the uterus. The second way that it works is by actually preventing ovulation. So every month, part of the menstrual cycle, 1 egg will be released from the ovary and it will travel into the fallopian tube and it will wait to be fertilized in order to create a pregnancy. So hormonal birth control actually prevents the egg from ever coming out. Therefore, a pregnancy would not be able to happen. And the third way that hormonal birth control works is by thinning the lining of the uterus. So in the uterus, there's this lining of blood and tissue. It's called the endometrium. And every month, if someone is not pregnant, that's what is shed, and that's the menstrual period. But in this case, birth control, hormonal birth control, will actually make the endometrium very thin. So it's not going to be a hospitable environment if an egg and sperm were to meet. It would have a really hard time implanting onto the wall of the uterus. And that's another reason why hormonal birth control makes like a woman's period really light, because the endometrium is so thin. All right. So moving on, I just want to give you a couple examples. So one example of a hormonal method is called a long-lasting method. Sometimes they're called long-acting reversible contraceptives, or LARC. And in this case, there's 3 different options. Excuse me, 2 different options. So there's the arm implant, and that goes inside the arm right here. And it's going to last for like 3 to 4 years, depending on which implant you get. And then the other option is the IUD, which is an intrauterine device, and that's actually placed inside the uterus, and it can last for up to 10 to 12 years, depending on which one you get. So these ones, since they're hormonal, they would prevent pregnancy, but it's very important to remember that a hormonal method does not prevent STIs. So if you're having a conversation with your student, if there's somebody who could get pregnant and they want to go on a birth control method, you still need to have a conversation about STI protection if that's something that is, possible for them. We do provide IUD and implant at Teen Clinic, and it's completely free as well. All right, so moving on, so the other hormonal methods are going to be like a short-term version. So we have the pill, the patch, the ring, and then the every 3 months, you could get a shot called Depo-Provera. So this is a very shortened version of the presentation. When we're in a classroom, we really go into each method and talk about it and how it works, so that the students know. And again, hormonal methods do not prevent STIs. So if somebody is using a birth control method to prevent pregnancy, they can also use condoms to prevent STIs. You can use both at the same time. Okay, so moving on to barrier methods. These would be the type of birth control that prevents both pregnancy and STIs and HIV. So common barrier methods would be things like an internal condom or a female condom and an external condom or a male condom. There's also something called a dental dam. Has anyone ever heard of a dental dam before? So a dental dam is a thin sheet of latex. It's a rectangle, and it would be used for oral sex. And a lot of people are like, well, why do you need protection for oral sex? But the thing is that you can actually get STIs from oral sex, and they can live in the mouth and throat. One common one that has some serious side effects potentially is HPV, or human papillomavirus. So that is an STD that's actually vaccine preventable. There's a vaccine called Gardasil. It's been around for many years now. But HPV is a special type of STD because it has a lot of different strains to it. And some of those strains could potentially cause cancer of like the reproductive system and cancer of the mouth and throat. So there's Michael Douglas, the actor, married to Catherine Zeta-Jones. He's come out saying he has mouth cancer from HPV, from oral sex. So 2 ways to prevent that, obviously getting vaccinated, and then also using condoms or dental dams for oral sex. Alrighty. So what is the best method? So really, again, the best method is the one that the person who's using it is confident in it. They're going to use it correctly every single time. They're going to be consistent in taking it. If they're getting something like the pill or the shot, they're going to be consistent with their appointments, going to pick up the prescription. If they're using condoms, they're going to be consistent with bringing condoms with them every time they're going to see their partner or every time they think that they're going to be having sex. Really just being prepared, because if you're not prepared and you're like, well, yeah, I would want to use birth control, but then you're not prepared, it's like, then what's the point, right? So really being consistent and correct and using it correctly every time. All right, another topic I just wanted to cover is consent. So this is something that we talk about in almost every lesson that we teach in schools. And we really talk about consent in terms of sexual activity, but also in terms of just like a daily life thing, right? So every single day you ask for consent, whether you think you are or not. So you ask your parent, can you take me to the mall after school? Can I go hang out with my friends after school? After practice, can I go meet my friend at the taco shop? All of those little things you're asking for consent. It doesn't have to do with sex, but it's the same idea, right? So we want to make sure that in a situation involving another person and touching another person's body, there's always going to be clear consent. So what is consent? Well, consent is giving permission to engage in something with someone else. Consent is fluid, meaning you can give it and take it away at any time. And consent does not exist if there is a power imbalance. So if there is like, a huge age difference, if it's a really unhealthy relationship, even if somebody says like, yes, I want to do this, there could be something, pressuring them. And I really like this example. Consent is like prize. So it's freely given, it's reversible, it's informed, it's enthusiastic, and it's specific. So the way that we teach the students is that consent, you don't want to just, it's not about no means no. It's about yes means yes. So if that person doesn't want to do something, then you don't need to do it. Then just stop. Just like if you don't want to do something, you don't have to do it either. And consent and making sure that we're communicating with people is really how we prevent things like sexual assault. So it's really, really important. All right, so that's basically the end of my presentation. Short and sweet. Just want to talk to you about the services we provide for teens at San Ysidro Health, and then a little bit about what we would do in a classroom presentation. Does anyone have any questions?
So is abstinence in the is birth control next? Still the next most
Effective.
most effective.
Yeah, that's a really great question. So obviously abstinence is 100%. Something like an IUD or an arm implant that's going to be placed by a provider and you kind of like set it and forget it. Those are going to be the next best because they're like 99% effective, over 99%.
I wanted to be clear, is an IUD an intrauterine device?
Mhm.
It's implanted and it stays there, or is
Yes.
it something that is removed every time or inserted before intercourse?
Yeah, so great question. So it is inserted once by the doctor and it will stay there. Yeah. So it will stay there a number of years. You can have it removed at any time, but it's not something that you need to continuously replace. So that's a good option for people who like know they don't want to have kids for a long time. A lot of times women will get it after they've had a few kids and they like want to, figure out if they want to have
How
more.
effective is that IUD?
That's like 99.8% effective.
Because when I went to school,
Uh-huh.
it was different. It was a female inserted a device before it was not.
Yeah, so there used to be quite a few types of contraceptives that you would put in right before sex, like the sponge, the cervical cap, and a diaphragm. Those are really not prescribed anymore, just because they're not as effective, and you have to use something called like a spermicidal lube with it, and it just is kind of like an inconvenience. Whereas now we have all these options where you can just go to the doctor, get it, and not have to worry about it for a few years.
So this type of new IUD, is it any drawbacks for it?
So there's going to be side effects with any type of hormonal method. Usually they're pretty minor, like a change in your menstrual cycle, maybe some mood changes, maybe like 3 to 5 pounds of like water weight fluctuating. But really they're safe. They've been around for a long time and they're really highly effective.
Does it release some kind of medicine or some kind of?
Mm-hmm.
Oh, okay.
Yeah, so they're hormonal. So basically the way it works is the way that it's manufactured, the material, it has the hormones in it. And so just like your skin, if you put lotion on it, your skin absorbs the lotion. So when it's inserted inside the uterus, the skin, the tissue absorbs the medicine that way. Yeah, good questions. Of course.
So ultimately it is hormonal prevention by IUD, but not IUD itself.
So yes, the device is not going to prevent the pregnancy. It's the medicine that's on the device. Yeah. So there's another type of IUD called a copper T Iud. So that one is not hormonal, but it is made of copper. So copper, interestingly, is like the foe of sperm. So when copper is in an area where sperm is, the sperm die. So that device would prevent pregnancy by device. The other ones are going to be the same shaped device, but they would release the medicine, which would prevent the pregnancy.
And how effective is that copper?
The copper T is about the same, over 99%. Yeah. That one has a little bit more side effects, but I mean, the thing is with birth control, it's kind of like trial and error. So, and a lot of young women get on birth control for other reasons than to prevent pregnancy because it's a medication that can help with a lot of things, acne, helping with their periods. And if you think about it, it's a hormone medication, and we know men and women get prescribed hormones for lots of different things. And so, in this case, hormonal birth control is a medication first to prevent pregnancy, but also has a lot of other ways to help prevent things.
I heard that a woman takes some kind of hormonal preventative method. put on weight. Is that true?
They put on weight. So it could be about 3 to 5 pounds of water weight. And it's not going to be, they're not going to be gaining like a lot of fat. They probably wouldn't change like their size and clothes. It really has to do with just how the body retains water when they're on hormonal methods. But that's the same, it mimics the menstrual cycle. So if you talk to a lot of girls who are on their period, they might say like, I'm really bloated. And that's because their body is like retaining water at that time. So it's not going to be like a massive change in weight.
I have a friend, and his wife suddenly I saw 3 months period, or less than 3 months period I saw when I visited their family. He had gained so much weight, not recognizable, everything popped up, like nobody puts on the weight that fast. So I inquired from my friend what happened. So they told us that she took the injection every 30 days she takes, which was for 1 month, and that's why she's making her put on weight. So why is that? Why would suddenly somebody become so fat?
Yeah, that's a good question. I think that there's side effects for everybody, but also you have to consider like what your own behaviors are, right? So there could be other things going on and maybe it's just a coincidence. Maybe she is having some mental stuff going on, more stress, eating more, any type of change in behavior patterns. Stress has a lot to do with weight gain also.
It increases your appetite.
So hormonal methods are not always going to make you gain weight. It depends on how your body interacts with it. And again, it's really just going to be like a little bit of water weight. It's not going to be like an exorbitant amount of weight. So I would say that that person that was experiencing that was probably going through some other things or eating more or something like that, or not exercising as much.
I was very, very shocked to see that in 2 months, less than 3 months period, the person changed in his appearance so drastically that I could not recognize it to be the same person who you saw.
Yeah.
The family 2 months before.
Yeah, definitely. Yeah, I don't think that it's from birth control, but you never know. But honestly, that's not the norm for people who are on birth control. It's really not the norm.
And one thing which is missing in here is what is this? What is meant? How to describe or define and identify concept or the term sexual assault? That is
Yes.
missing here in this presentation for general awareness of the.
So that is included in our presentations with students when we talk about consent and we talk about sexual harassment and sexual assault and prevention. Yeah, we do include that. This is just a small version. But the state of California requires a certain number of classes to be taught in order for the education code to be satisfied. And the topics include all contraceptives, include sexual harassment, include sex trafficking, and include sexual assault prevention, includes information about healthy relationships. So it's very comprehensive. This was just a very quick snapshot of one of the presentations. Thank you so much. Any more questions? All right, feel free to take some resources if you'd like, and you can always send me an email or anything if you have any more questions. Thank you so much.
Thank you.